scary thing about hepatitis C is most people don't have a lot of symptoms. So over half of patients don't even know that they have virus, patients that have risk factors. So most people aren't going to feel bad. Sometimes patients will complain of fatigue, vague muscle aches, occasional abdominal pain, symptoms like that, skin rashes. They may have elevated or abnormal liver enzymes. As if disease is more progressed, more advanced, like stages of cirrhosis, then we can see other lab value changes, sometimes jaundice, swelling, confusion, things like that. But most people are asymptomatic.
Hepatitis C can present with pain in your muscles and just feeling tired periodically. So it waxes and wanes, and it just presents like that. Few patients over a period of 20 to 30 years will develop cirrhosis of the liver, and very few patients, about 1%, will transform to a hepatocellular carcinoma. So it's not like many patients will have that progression of the disease. It's slowly progressive.
Patients with HIV and hepatitis C typically have more severe forms of liver disease and of HIV. So they tend to have faster progression, more advanced disease. So particularly being able to identify those patients and getting them in for appropriate screening, workup, and appropriate treatment, and particularly paying attention to possible drug-drug interactions with these new medications is going to be crucial going forward. These patients also are at higher risk for things like fatty liver disease, which can accompany both hepatitis C and HIV, as well as be associated with the HIV medication. So making sure to encourage healthy lifestyles, diet, exercise, maintaining a healthy weight, things like that. Drug compliance is going to be critical. Similar to the HIV medications, these hepatitis C medications will need to be taken every day, routinely, for the best effect.
When people are co-infected with HIV, it's been shown that there's an accelerated progression of their disease, so maybe the time to cirrhosis may be quicker. It's not over 1 year or 2 years, but it may be quicker than what it is in an uninfected HIV patient. So there is more accelerated progression of disease, and it may accelerate HIV disease, or HIV can accelerate hepatitis C.
According to the ODH stats that we just took a look at, there are about 10,000 cases reported in 2013. About 116 of those reported to be acute infection. Those are based on the best data that we have to date, although we think that's probably underreporting. So we think prevalence is probably higher than that.
In the HIV population, about 25% of those people also have hepatitis C, but in people who have a risk factor of IV drug use, about 80% of those also have hepatitis C.
So when we were using interferon ribavirin for standard therapy with patients in hepatitis C, a lot of patients with HIV, we had limited treatment options for, depending on if they were on HIV medications because of drug interactions. With some of the newer therapies, there's going to be more avenues for treatment, particularly with the all-oral antivirals, so there should be more opportunity to treat those patients. Again, a lot depends on some of their comorbidities and other medications that they're taking. But at this point, the duration, rates of response seem to be pretty similar.
The clearance rate for hepatitis C was pretty low, maybe in the 40s, even 50s for people who had co-infection. But some of these new treatments, the clearance rate can be as high as in the low 90s to mid-90s, percent-wise. So it's much better treatment, much more effective.
The cost has been prohibitive for some patients. The medications are about $1,000 a pill per day for the two new direct-acting antivirals, sofosbuvir and cimipravir. So if you have a 12-week course of medication, you're looking at $80,000 plus. Some patients are using various combinations, so their treatment cost may be even higher.
So everybody with HIV should be tested with hepatitis C. They recommend that on a yearly basis. Refer them to the liver specialist if you're not comfortable treating the hepatitis C. And then there's also guidelines that have been put out by the American Association for the Study of Liver Diseases and the Infection Diseases Society of America, guidelines for testing, treatment, screening, everything you would want to know about hepatitis C. And then there's sections for co-infection also.